Hello, my name's Dr. Chris Salmon. I'm one of the general non-invasive cardiologists with Carolina Cardiology Consultants with the Prisma Health Upstate Cardiology Group. And today we're going to talk about the signs and symptoms and recognition of silent myocardial infarctions or silent heart attacks. What is a silent heart attack and how is it different? Typically, it's always in reference to what people think of as the typical heart attacks, which are those episodes of severe chest discomfort, shortness of breath, arm radiation, jaw pain that we kind of always tell people to look out for when people start having any sort of chest discomfort. With the silent myocardial infarctions, it's people that don't have those classic symptoms. They're usually more like fatigue, nausea, common abdominal pain, weakness that can happen intermittently. So that's why they get the moniker of being called silent versus just a regular myocardial infarction. What are the signs of a silent heart attack? The silent aspect of it is, like we just talked about previously, that you're not going to have the typical chest discomfort or shortness of breath or arm radiation. It's typically going to be more like fatigue. The symptom may be, even if you did have chest discomfort, it may be a lot more fleeting. You might think it's something else like reflux or just a viral infection if you've been hanging out around with kids or family during or a holiday season that you kind of just shake off. And over the course of maybe days to weeks, the kind of fatigue, weakness, nausea kind of stick around, and there usually isn't a really good reason for it. What we do know in general is that when people have heart attacks, more overt kind, men are typically, it's more common for them, but when we talk in the silent myocardial infarction kind of sphere, women actually have it way more often. So that comes back to those cardinal signs as far as abdominal pain, weakness, fatigue, shortness of breath, kind of a prolonged setting of that. And it's typically how women are going to present more so even though than men. Who's generally at risk for a silent myocardial infarction or heart attack? Well, typically, like I said previously, women are at higher risk than men typically for having silent myocardial infarctions. People who have diabetes are at higher risk, and then the elderly in general are at a higher risk for having myocardial infarctions. How can you reduce your risk of having a silent heart attack? Well, the biggest things is, and I tell all my patients this, is to know your body. If you kind of felt off and there's no real reason for you to feel off, like I said previously, you're not eating anything new or had any recent infections or sick contacts, and you kind of have these symptoms that have been going on for a lot longer than you should be, that's the first thing I tell my patients, is to know their body. And the second thing I like to tell them is to kind of know their risk factors. So if you have underlying diabetes, high blood pressure, any sort of cardiovascular disease history, that's kind of a red flag that you could be having the risk factors for a silent myocardial infarction. In addition, know your numbers. It's another thing I like to tell people as far as know their blood pressure numbers, know their blood glucose numbers, know their weights. Because if all those things are generally well controlled from a risk factor standpoint, you reduce the risk of having myocardial infarctions. One last few things is you got to avoid smoking in general, and I tell everybody that every time I see them, is that if you never smoke, keep not smoking. If you are smoking, you got to try and stop, because that can reduce the risk of having a silent myocardial infarction also. In addition, again, going back to what I said at the beginning, is to know your body. So know what's going on, know things are off for a little bit too long, and you feel kind of off, then you should absolutely seek help and assistance from a heart perspective with us or in the hospital in general. In the flu season, the RSV season, and the COVID season, people have a lot of reasons to not feel all right, and I think that our radar should be even more on right now, because those are things that have been shown that can kind of kick off these silent myocardial infarctions with acute infection. We have a lot of good data for flu. There are going to be data there for RSV and COVID in the near future, particularly with RSV coming back with a vengeance now. So, yeah, and if you're not feeling well, you should seek help out of the abundance of caution, particularly if you have risk factors.